Hello, my name is Carlos. I'm going to start off by answering the first question that is, if you could make one change in today's healthcare system, what would it be and why? One of the biggest changes that I think needs to be made in the healthcare system, it's making the environment safer for the patient. Um, uh, Today and age, I know that hospitals there's a huge push for infection control, and it really is a big deal, especially in the ER. I feel like it's a very, sometimes not the cleanest environment. Um, I know one of the ways that facilities, including my facility, has started doing is having a checklist or a buddy system where the facility makes a checklist, for example, for um, in and out cathing and accessing ports and things like that of that nature, where you have a list that you have a buddy that you take into the room, and the buddy reads the off a list, and the other person is the one providing the care to the patient, listens to the person, and sometimes that way things don't get missed, and it's actually supposedly cuts infection in half, according to some studies. So that's one of the things that I would start implementing, that I think really needs changing in the healthcare today in this country. Um, how would you know that the change has some improvement in the system? Um, what are some legal and ethical implications of this change? I've seen personally that, well, first, let's start off by saying how you would know if it's changing. Obviously, you would know by seeing infections acquired at the hospital, if the percentage has increased or decreased. I feel like that would give you an idea if what you're doing, our buddy system, is working in cutting the infection, because that's the goal. Um, One of the things that I feel like doesn't let this happen is sometimes nurses having a lot of responsibilities and being too busy with other patient care, or their counterparts also doing the same. It's sometimes hard to grab another nurse and be like, hey, come with me and uh, do this catheter. It seems like a really simple task, or accessing the port. It seems like a simple task, but you would be surprised how much that could be a source of infection sometimes. Um, so sometimes I feel like that gets in the way of implementing this buddy system, just being understaffed, and having a lot of tasks that need to be done at certain times. Sometimes plays a lot to do with it. So um, let's see. About the nursing leader, and they ask you about the changing the role. How do you think the nurse's role is going to change in 2020, including quality, patient outcomes, and reimbursement? I feel like a nurse is already very, very involved in the quality of healthcare that the patient receives, and that is because we spend most of the time with a patient. We all know that sometimes healthcare providers or doctors don't spend as much time one-on-one with a patient as they probably should. I don't really see that changing anytime soon. And obviously, the quality of care that's being provided to the person automatically impacts the outcomes of the patient. Um, and I feel like nurses already also have a big say in the reimbursement that the facility gets, because of documentation that the nurse provides. Sometimes, based on nurse documentation, facilities can know whenever there was something not done right, and sometimes they blame the hospital for that, which automatically impacts their reimbursement. I don't really see that changing anymore. As a matter of fact, the hospitals are making a huge push, and or orienting their new nurses well, so that they don't mess up and they don't cost the money hospital. Uh, the type of delivery, the nursing care delivery model I would implement in 2020 would be the shared governance model. This model really tries to gives the RN a lot of autonomy. Uh, by that I mean sometimes an RN might not agree with what the doctor's orders are regarding a patient care. Sometimes um, in this shared governance model, the nurse is encouraged to voice his or her opinions regarding patient care, which automatically impact the patient. Sometimes the MDs don't really know the patient because they don't spend that much time with them as sometimes a nurse would, and that's why the nurse's opinion is very important. Um, in order for something like this to work, though, you need to have you need to train your nurses to be outspoken. You also need competent nurses that know what they're talking about. It's not just something random. You need to encourage leadership skills in the nurses, because once these orders need to be taken place, need to be implemented, the nurse can lead the direction of where he or she thinks that the care needs to go. Um, I feel like you know that this your system is working, that this shared governor system is working because you're obviously going to receive higher patient grades. You know, Press Ganey scores are very important in my facility. One of the ways to improve these scores, I feel like is gives us a lot of say, and improves the scores. Obviously, I feel like once a nurse feels like they're comfortable in this environment, it can also lead to higher nursing retention. Um, Nurses will want to stay in an environment where they feel like they're valued and have a say in patient care. Um, and also nurse feedback. You know, you'll know from your employees if they do like this model of care. That will tell you a lot about whether you think this is going to work or not.